And so Acteon came out with a phenomenal product. It's known as the SOPROLIFE. And so it has light-induced fluorescence, just like the previous one. So again, an intraoral camera that's plug and play with a USB. It's very fast, easy to implement, high resolution, and instead of being just the ability to take a photo and show patients what's happening, it has the Caries fluorescent technology. So again, you can see where bacterial byproducts are, suggesting that you may have pathology in these areas, and it should have further investigation. Getting that patient involved is very important, because if the patient doesn't have discomfort, oftentimes they may think they don't need to have any dental work, which is completely wrong, as we all know, but getting them to understand and be a part of it is why this is so valid. And this became very important for implementation for the dental assistant, for the hygienist, for the doctor, and even for the front office staff to share these images with the patient when they're discussing treatment. So visualization of a tooth such as this is wonderful, because most patients go, oh my gosh, what is all that stuff? Is that decay? Do we need to fix that? They're asking all these questions, versus when it's in their mouth and it's just an x-ray, they have no idea what's there and that it looks like this. Now add in another component of this fluorescent technology, and instantly you can say, yeah, there's a bunch of, calculus tartar debris there, but also look at this red area. There's bacteria playing in there, and they're giving off these byproducts. There's potentially a cavity in there, and if there's not one currently, there's going to be one eventually. Let's start talking about how we can make it so that this never gets any further, any larger or progressing. And so it's a great discussion to start having with your patients. And we see this time and time again. A tooth like this that really doesn't look that bad other than some stains, to be able to show a patient that, hey, there is something there. It's just so small you don't see it. Let's change the image to make it more understandable, and why we should talk about doing something long-term as a preventive means. And so Acteon SOPROLIFE was a very wonderful tool to help get patients engaged and to see where we may have pathology present. So having both a traditional daylight mode to see problems and cracks and things in the teeth, as well as the diagnostic mode to be able to detect caries and problems in the tooth, and also the treatment mode as we're working on the patient to see what's happening down inside the tooth to help further evaluate as we're working. Certainly very helpful. And they expanded this into utilizing fluorescence into their SOPROCARE. So Acteon, starting with just the fluorescent technology to find cavities, expanded it into the ability to find both plaque and tartar buildup. So now it's implemented into the hygiene role, so the hygienist can show patients why they need to brush and clean better, or come to the office more regularly, because they're missing out on all this orange stuff that you can see in the middle image, which is all the buildup that you wouldn't normally see to the naked eye in a normal photograph. But now you can see it. So getting, again, the patient involved not only in the dental chair with the dentist, but also the hygiene chair.